Good day, everybody. Thank you for joining. We'll be starting shortly. We're just waiting for folks to have enough time to join the webinar. Thank you for your patience. Please do feel free to introduce yourselves in the chat and tell us where you're from. Good day, everybody. My name is Sarah Hess with Geneva, in Geneva, the World Health Organization. Welcome to this EPI-WIN webinar. I'm really delighted to have with me here today Syed Nazaket, who is the founder of DataLEADS. Syed is based in Delhi in India. Thank you so much for being with us today to share the work that you do on such an important topic. And I know that you have a lot to cover, so I'm not going to take up any more time. I'd just like to say to those listening, if you do have any questions for Syed, please do put them in the Q&A function on Zoom, and we'll try to get to some of those towards the end of this webinar. In addition, and as usual, we will be able to share a copy of the presentation with you after this webinar, and the webinar is being live streamed to YouTube, so you will be able to see a recording of it there post the event. So thank you once again to Syed for joining us, and thank you to all of you from all around the world. It's always very exciting to see the global audience that we have for joining us. And so Syed, without further ado, I hand the floor to you.
Thanks a lot, Sarah, and really glad to join you on this really important subject. I think we are going through a very serious situation globally from the last 1 year. It has been extremely tough, and particularly the second wave in different parts of the country, in world, from Brazil to India. Certainly, we're based in Delhi, and I'm pretty sure that that things have been really bad here. But I think that makes our discussion, our conversation more important. Why we need to discuss how critical it is to have accurate and timely information about health, and how much difference that information actually makes to communities, to society at large. So I'm going to share a couple of slides with you just to make a couple of points about how we at DataLEADS are working and have been essentially contributing our bit in this fight against, you can say, infodemics or misinformation, health misinformation. So I think it's as Sarah mentioned, so I'm based in New Delhi. I'm a founder of DataLEADS, which is a digital media organization, and we have been working with different partners, particularly with Google News Initiative, Internews, in order to bring a lot of competencies of fact-checking to this part of the world. And I think the fundamental part of any conversation, of any society, is the information, is the access to information, is the access to timely information. And that makes that community or that society powerful when they have access, when they know what's happening all around them. And what we have been seeing actually in the last, you can say, particularly last couple of years since the rise of social media, there's too much information. And it becomes like for a person to understand what's happening, he's hearing 100 like sources of information, and then he's not able to really understand which one is correct and which was he should take a decision on. And the problem essentially is that if he takes a decision on a wrong, on a false information, that has consequences. That has serious consequences. And we have seen people have actually lost lives because of they believed on something which was not true, and they took a wrong medicine, they stopped, for example, a medication because on a wrong advice, on a false information which was circulating on a social media platform, or they heard from somewhere that this is what it is. And in the last 2 years, essentially, since the outbreak, pandemic outbreak, we have seen uh, how these things have actually played out across the world. I think there's hardly a country where there's no debate about infodemics, where there's no debate about why different stakeholders need to come together and fight the misinformation. And we saw a situation in Iran where almost 700 plus people died because they believed on rumors that the alcohol kind of a drink can actually save you from COVID. And they, one after another, they started having the drink, and all of them ended in hospital. More than 700 people died. There have been a number of other cases all across the world where people actually went for an absolutely wrong thing because they just believed on a rumor, on unscientific claim. We have seen that whole, not really debate, but you can see the whole issue about people not wearing masks because somehow they have heard that no, this is not going to protect us. And that really made our job, you can say, as a society to fight the COVID-19 much more difficult. Like imagine the second wave we are witnessing all across the world, and major responsibility, if you look at beside the state and then the machinery and the system, is also individual choices we all made in the last 1 year. There were hardly, in most of countries, there was a struggle all the time to convince people to wear a simple mask because it's going to protect them. Why they were not doing it? Perhaps, I'm going to, like explain a couple of, narratives, what happens when infodemics happen and people almost start feeling unable to decide which kind of information they should believe. Why is this happening actually? It's very interesting and quite insightful that why is this all happening at the time. This is happening because for the first time in the human history, we have access to more information than we are able to consume it or understand it. And it's happening for the first time. For centuries and centuries, we were searching for information as human beings, and we were looking for small bits of information, and then we were trying to process and consume that, and that was absolutely fine. That we will read a newspaper and whole village will read that, and then we were all okay with that, and we all feel like empowered, we know what's happening in the country. Today the problem is you're getting 1 million newspapers, apps, tweets, millions of photos and videos on social media, on Facebook, on Twitter, and we are consuming all this. And the problem because of that is that we are not really able to figure out how to separate truth from fiction, from false information, because it's too much information. And I think this is one of the main reason why people often get confused, why there's a chaos, why there's a you can say a unwillingness to do something because they're not really clear what to do. Should they wear or should they not wear, or should they go out or not go out? Because there's too much information, and this is also happening. There are also reasons behind it. Why also then essentially it's like when there's too much information, that is the challenge. But I think one of the we have seen, and at least in our research, in our work in the last 2 years, we have seen often misinformation circulates or spreads when there's no information. When the states or the government machinery decides not to share information with the people, the rumors start filling the gap. The misinformation starts, like occupying the space. So we have seen it's not like misinformation uh, begins from a vacuum. No, it begins the moment when we do not share the rightful information with the public, when we don't keep them informed what's happening. And that's essentially what's happening in so many countries and communities, that when the governments and systems, they decide to hold back the information, that creates a really lot of space for rumors, hearsay, a lot of mis and disinformation. We have seen issue with the data deficit, that people really do not know as basic as how many people are dying. We don't know that data. So how you're going to trust anything? Then you start looking for all kinds of rumors, all kinds of false misinformation, misleading information, because you don't know what's happening. You don't have the real numbers in front of you. And we have seen it. It's not only about COVID, even on, for example, on cancer, on tuberculosis, on malaria, on any major global, major disease which takes a toll of millions of people every year. Most of countries do not have a basic data collection system in place. Even if they have the data collection system in place, they do not collect updated data. Like on cancer, I've seen all across Asia, except one or two countries, there's no data available from the state governments. Actually, the data which is available there will be either 5 year, 6 year old, and will not be, if you check it and verify it, you will have a lot of questions about the quality of that data. So data deficit certainly huge. The lack of overall media, and you can say health literacy, how to be a critical thinker when you consume some information, how to understand what is difference between opinion and news. So that the lackness of media literacy overall in our societies also plays a huge role. Then the rise of social media, like when millions of people suddenly for the first time are online, they're sharing content, they're liking content, they're consuming content. And then you can say profit, propaganda, politics, distrust of the system. All these are actually key reasons why there's a misinformation. And what are the consequences of this? There are serious consequences. Like in India, a couple of years back, in one of India's most educated state, Kerala, the vaccination for kids was stopped because there was a rumor that the vaccines, MMR vaccines, are going to harm kids. And it started with a WhatsApp message. It became viral across the town. 200,000 kids, they didn't went for a vaccine for 2 months actually. So they got the vaccination, the period got delayed because of that misinformation. We have seen the situation in Afghanistan. We have seen the situation in Pakistan about the polio vaccine, where the doctors were attacked by people because there were rumors, no, these doctors are working for CIA or they're working for some secret agency and they're doing the profiling. Though that has a historical background there in that country, but we saw misinformation makes work of health, you can say stakeholders, very difficult on ground, because I think that's one of the reasons why we're having these lot of vaccine preventable diseases still so widespread in our part of world, in Africa for that matter. And we're also seeing what are the major dangers of all this. If there's a lot of misinformation or disinformation, what are the dangers of this? The danger is there will be a lot of fear, chaos, there will be stereotyping, there will be racism. And we have seen during the COVID how particular communities were targeted because they were hold responsible for actually spreading the disease, for spreading the virus. There will be, you can say, the response to the healthcare crisis will not be effective because people are not cooperating actually with the initiative. And then perhaps maybe people will stop taking any medicine or any precautions because of this and misinformation. And we are seeing all of this. And we have been discussing it within India as well from the last 1 year, how terrible consequences of this mis and disinformation have been in the country. And it's a research. I wish that the people who have interest in research, they collect this data. There's a lot of data available now, and they go through the data and see how difficult the misinformation has made the whole work of dealing with the COVID-19 so difficult. Had there been no misinfodemics here, it would have been much easier to deal with the situation. Just yesterday, at 3 major hospitals, the doctors were attacked because there was a crisis about oxygen, and then someone said, no, they are stealing the oxygen, giving someone else, which was a rumor. But before the hospital can kind of confirm that, the doctors got attacked. So I think the key here is that this is not an issue of, you can say, public health professionals or data scientists or public health advocates or doctors or technologists to come and be a superhero here. No, I don't think that is the situation here. The situation here is that it has to be a collaborative initiative. It has to be a collaborative initiative, having different people with different domain expertise on ground. Like if we look at major tech companies across the world, they're hiring students with arts background to understand why certain content goes again and again and it circulates again and again. They're not only hiring the data scientists and technologists, they're hiring art student because they're hiring psychologists to understand why some people love to share some content again and again. Like it's like a so the key here is that there's no space for a superhero here, and that one organization, one government, one person, he will come and he will solve this problem for everyone. No, it's not going to happen that way. It's a societal issue. It's a multi-stakeholder thing. Everybody has to chip in with different strengths, and then they have to make sure that they are all willing for this collaboration for a long term. Because what's happening right now is, you can say, it's like a challenge, but what is going to happen in next 5 or 10 years is going to be a crisis. Because even today, half of India is not on internet, and so is the situation in so many other countries. But in next 2 3 years, everyone in the world will be on internet. There will be millions of people who will be on internet for the first time. What are they going to consume? What kind of content they're going to consume? What kind of content they're going to share on internet? These are very important questions. And what is the consequences of that for public health, for medicine for that matter? We have seen already videos which have got millions of views and likes and shares, and they were selling something completely absurd as a cure for cancer. And people were surprised not only about it got 1 million 2 million views, but below the views there were comments actually, and people were asking, can you tell me where can I get this cow urine for cancer, and is there any shop I can buy this cow urine from there for cancer? So why is that happening? Because there is a huge gap between different stakeholders. Because often people think, oh, it's a media crisis, is a media crisis, and journalists have to take care of this. But and then or journalists think, no, this is a crisis of healthcare ministry, or it's a crisis of healthcare professionals. Let them take, this is science, we can't deal with it. And technologists think, no, our job is to monetize the content. Our job is not to really monitor the content. So I think that that has been a challenge in last couple of years. But I think COVID also brought us together, and it was so you can say satisfying to see so many partners coming together during the COVID, like TikTok doing WHO videos, the YouTube doing WHO videos, the UNICEF coming on board, the journalists coming on board, the world's biggest fact-checking network I've seen coming on board, Google, everyone, I think somewhere on a bits and parts, all trying to pitch in somewhere, and all trying to figure out this is a new territory. We all are new in this world. How are we going to deal with this? Like our generation, our father and forefather, they never had this situation. But now our kids are going to have this situation more and more at a different scale, at a bigger scale. So I think our story behind this, DataLEADS story behind this, started actually in 2015 when we actually started looking at a lot of open source data which was being made available by the government in India. So when that data was made available, and then my question, I actually was having a conversation with myself. I was thinking how to make sense of this data which is being released by the government. Though despite the quality, and that is a separate question, but whatever data is being made available, that still gives a lot of insight. So how to make sense of this information, how to make sense of this data? So that's how DataLEADS started in 2015 as a small organization with two team members to make sense of this whole, like a new world. What we did essentially was that we saw, let us check whether doctors will be interested to work with journalists. Is it possible that we can have doctors joining hands with us and we do something together? So it was a very absurd idea. So what we did, we selected 20 doctors and 20 journalists. And in one part of India, in one remote Himalayan part of India, we sat for a day in a one small room, and we called it Data Bootcamp. And in that conversation, which was like a 6-hour conversation for a whole day, it was conversation about how to clean health data, how to make sense of public health data, how to write for data, and how to have a collaboration, stronger collaboration between public health professionals, doctors, preventive medicine professionals, virologists, with journalists who are writing on health. And our idea was, honestly, my fear was that the journalists will come for this event. This is a workshop, it's a free workshop. They will come, but I was not really sure that the doctors will come for a whole day and spend like 8 hours, 7 hours with us for that workshop. To my surprise, when I reached to the venue in the morning at 8:30, the room was half filled. The doctors were already in the room waiting for the workshop to get started. And the journalists were coming one by one, this thing. So that was a really beautiful experience, to be honest. And that changed my perception also to my presumptions as well, that, we presume that people do not want to collaborate without actually ever trying actually. So that actually gave a lot of hope. And then, we ended up actually taking that initiative all across Asia. We went to Nepal, we went to Malaysia, we went to Sri Lanka, we went to Bhutan, we went to Thailand, we went to Maldives, we went to Hong Kong. We went all across Asia, and the concept was similar. In each boot camp in these countries, we were having a team of 50 doctors, virologists, microbiologists, data scientists, and 50 journalists, editors, and some fact checkers, you can say, like, data journalists and all. And over the last 4 or 5 years, it has created a huge ecosystem, at least in this part of the world, where we have these doctors, virologists, public health professionals, journalists, fact checkers who are based in, you can say, Malaysia, who are based in India, who are based in Pakistan, who are based in Hong Kong. And we are in touch in our different ways and means to make sure that we do something together. So just before COVID-19 actually hit us, we had a huge summit, and Google was a great supporter of that. We hosted it in Singapore. So almost 400 people, doctors, scientists, technologists, journalists, joined us in Singapore for that summit. And the name of summit, which was much before the COVID, was Misinformation in Medicine. So that summit also helped us to create something unique again at a different level, which was essentially a new initiative which we started called FirstCheck. So FirstCheck is a dedicated website. You can check it if you Google it, firstcheck.com. It's essentially a website which fact checks medical misinformation, health misinformation, with the help of doctors. So what we did essentially was that, and you can see all the members actually on your screen. What we did essentially was that we put a open application form, and we asked doctors across Asia, will you like to support us in terms of fact checking unscientific claims or false claims about health, about medicine, about different diseases? To our surprise, again, 100 plus people signed up in, I think, in 1 or 2 months actually, and all very qualified and all. Out of them, we interviewed them and we selected this first, you can say, a slot. They're all senior, like doctors based across Asia. And what we did then, our understanding with them was that it was a pro bono, it was a volunteer work. We just need 2 hours every month with them, with each one of them, either to help us through an interview, either to help us to a fact check a claim, either to contribute a right opinion column about something which is like a misleading and false, and so that we all can work together, make sure that it does not go beyond, it does not harm population out there. So we are able to like fact check and debunk it before it hurts people. So that was, like a first check for us. And first check was also like a essentially the day now it works essentially is that there are these doctors who are very experienced, and in the middle of COVID they have been like almost, we have done almost 200 fact checks in the last 1 year on very serious issues with the help of these doctors. And they join us on either on email, either on phone calls, or either on a WhatsApp group, and then we share with them if there's a misclaim, if there's a false claim about any particular health issue, and they come back and they share their expertise, and we publish the outcome of that. So we are also very keen actually now to expand this Pan Asia group to make it really more global, and how have people from Africa joining, from Europe, from America. If anyone in this group, you can take a screenshot and you can actually fill up the form or write to editor at editor HAI India and join essentially this initiative of fact checking, because we honestly believe that we need more people, more qualified, doctors, and more experts who can chip in and actually help to debunk and identify and halt a rising tide of misinformation. So this was essentially also at a time where we collaborated with Internews and Google News Initiative in 2018 to start something, again, a very modest a training. So we thought, like, in India, we have hardly one or two fact checkers. Can we train journalists in India and media educators how to fact check? What are the simple tools and techniques and approaches you can adopt, and then you go ahead and you train others. So what we did essentially was that we had one, we can say, a workshop for 4 days, which was called training program, TOT, and one after another we had five of them. So we had 250 trainers on board, and they were all senior journalists, media educators, professors, and we again selected them out of 5,000 applicants, those 254. And then since 2018, they created something in India, which I personally think is just remarkable. That this is what we call it Google News Initiative India Training Network, which DataLEADS actually leads in India. It's just remarkable. The story of it's just remarkable. How individual journalists came together, editors came together, media educators came together, and pioneered an initiative in the country which has reached almost 700 universities, 1,100 newsrooms. So more than 35,000 participants have got benefited from this training in the last 2 years, and it's still ongoing. And right now, if you look at in the last 1 or 2 years before the COVID, we were actually meeting face to face, doing these workshops, and helping each other. What are the simple tools and techniques we can adopt to fact check information? But now, even in the middle of COVID, this network of trainers has been phenomenal in terms of helping people to debunk vaccine related misinformation, debunk COVID related misinformation, the treatment related misinformation. And right now, from the 1st of May, we are starting another initiative under this, like a Google News Initiative India Training Network, which is essentially a training series, a town hall training series to help people to identify vaccine related misinformation. So starting from the May 1st till the end of June 8, we are going to do 30 town hall online series workshops across India in every state in different languages. And all these trainers, 250 trainers, are leading this initiative and helping people again in the middle of this crisis again. Because eventually, if there's a one thing which can save us from the current crisis, that's only vaccines. And the government of India has decided from the May 1st, they're going to make vaccines available for all the adults. So there will be huge rush for vaccines from the May 1st. In the middle of that, we are starting this training, just helping people and journalists and editors, everyone actually, community radio stations, to make sure that they understand the consequences and they identify the misinformation related to vaccines. So in this process, it's like a learning. It's like a one thing after another. So where we were dealing with the journalists and fact checkers and media educators, but then deep down we also started to realizing that we did a good job, but then we are not really reaching communities. So our training is somehow limited to media and information and all, is not reaching to communities. So then again, in collaboration with Internews, we started another project 1 year back, which was called Factshala, right? Like a school of facts. And we again did the same training program. We had 260 plus trainers on board. You can see them on screen. All senior, like professors, media educators, community leaders, faith-based organization leaders, community radio stations, 60 community radio stations across India. And in the last more than a year now, they also created a huge ecosystem in India. From in every state of India, they conducted the training despite of COVID actually. So they made sure they will do online, but they made themselves available. What we did was that we created a curriculum for them, 3 subjects. One was how to build critical thinking. If you're an individual, how are you going to build your critical thinking? Second, how are you going to verify content, whether that is photos and videos? And I think third was what is information? How do you understand different formats of information? And they went with that training, and they did the training in local languages. In you can see the couple of pictures, like in a top at Himalaya in a village. A girl went and she did a training in Himalayas, one in Rajasthan, another somewhere in a small village. So these are ordinary people. They don't know a lot of stuff. But we made training so simple for them because our understanding was that it needs a whole of society approach. It can't be only journalists, doctors, and government. It has to be communities as well. So this whole exercise again led to us another initiative last year, which was again supported by Google. It was essentially, can we monitor what people are searching on internet, and what kind of insight will that provide us about the misinformation? If people are searching, typing something on Google, what kind of insight that gives to us? So Google gave, under this project, Google gave us access to their question hub, and the project was called Fact and Fit. And we had a team of doctors with us. And with the help from them, we identified, I think, 14 keywords and diseases essentially, which we monitored across internet. And it was a project which was done in Nigeria as well as a pilot, and India as well. In both countries, two different organizations participated. India, we led it along with other partners. And what we did essentially under this project was we monitored what people were searching online, whether that will help us to figure out what is getting viral even before it becomes viral. And that was again a huge interesting like a subject, because we also realized the most Google searches are actually about health. They're not about money, they're not about banks, they're not about cars, they're about health. Most Google search across the world, most Google search are about health. So now if somebody is writing, I'm having this problem, where should I get this medicine or whatever, that gives you some indication what are people searching. Can somebody reach to that person before misinformation reaches that person? So that project was again amazingly insightful in terms of identifying vectors, early vectors, even before the content becomes viral. So if I like sum up the experience in a couple of things, actually, I think, yeah, if I sum up a couple of key points actually with the whole experience, I thought one thing is fundamental, and which is just fundamental. If you don't get it, you don't get it. That is the process of verification. Don't believe anything unless it's verified by someone, or either it's properly attributed to someone. And then you can say, no, this is as per this person, but you know who person, which organization. So I think verification, it's a skill of 21st century. I think we need more people who have capacity, who have knowledge, who have understanding how to verify things. It could be verification of, content in terms of photo and images. It could be verification of approaches and narratives as well. So I think verification is fundamental in terms of moving forward and fighting, you can say, false claims, false misinformation, for false information about health. So when you go to the verification, so we do actually a day-long workshop on photo verification, full day workshop only on photo verification, and another day workshop only on video verification. Then one complete workshop on, we can say, social media monitoring. So again, amazingly simple, to be honest. Like there's a tool called, so simple you can learn in 15 minutes. And I keep telling people, if you learn Google reverse image search, or Yandex for that matter, or reverse image of a tin eye, 50% misinformation you will be able to identify on your own. You don't need any rocket science. 50% almost. If you learn these three simple reverse image search tools, all you need to do essentially is to spend 10-15 minutes how to use Google reverse image search. Extremely easy and simple. I can show you maybe during question answers when session, I can show you one or two of these tools, how easy they are. A lot of people actually were surprised when they go through these training. They say, it was so easy. And I can at least now verify a lot of photos before sharing them on WhatsApp. So similarly, there's a tool called, lot of stuff. This tool again for video verification. Two good tools, free of cost. One is Data Viewer, which is by Amnesty, which was actually essentially created to check human rights abuses in the video format. But then they made it public. Now you can use this tool actually to check the dates, locations of YouTube videos, millions of videos on YouTube. You can check their dates and locations with the data viewer. Similarly, with InVid, which is again a strong tool, you can actually figure out a lot of metadata about videos. You can see them in frames. You can break the video in 20, 30 frames and then search again that particular frame and see is this the video essentially from this place or not? When was this video uploaded or taken? So all this metadata is, like you can extract that data with the help of Invid. Again, very simple tool, hardly takes, I think, 10, 15, 20, 30 minutes to learn and then the practice. But I think these are very important tools. These are very important, simple tools, and there are so many others as well. But I feel like very important for us to, in order to monitor the content and check what is getting viral or what could become viral, what could become harmful for people. Can we stop it before it becomes harmful? So that is also what we call social audit. Very good, and very useful tools. Most of them are free of cost, except I think Hootsuite and Masterpoint. All of them, rest of them, and CrowdTangle to some extent limited, but rest of them all free of cost. So these tools actually will help you, like MetaPace will help you to figure out the date of when a picture was first taken and with which camera was it taken, right? It gives you that, and what time of, like it gives you a lighting as well. CrowdTangle, phenomenally useful with the Facebook. TweetDeck with Tweet, it helps you to figure out the tweets. So all these tools, they allow you. Geocode helps you to figure out if you're interested to know what is happening in this part of the world right now. What are people tweeting in Nigeria right now? In one village in Nigeria, in one village in Johannesburg, in one village in India. You can go to that village, and with geocode, you can see what people are tweeting and whether you can stop that, or if there's a misinformation, can you stop that misinformation right there before it becomes viral, because we're all connected on internet. So I think these are very important tools, and there are resources available also on our website. You can actually download them. There are videos uploaded on our YouTube channel. You can download them and practice them if you're interested. But these are very simple tools. So there are a couple of questions here which we need to really think quite deeply in order to understand first what is the problem and what should be our response to this, because it's going to be bigger and bigger. I can see in the last 2 years now after COVID-19 is a different world. I think every government, every major organization in the world understands the dynamics of the misinformation, the chaos and the loss which could suffer because of misinformation. And that's why so many organizations in the world are hiring people who have expertise in this area. So it's very important for us to diagnose it before we start treating it. So diagnose is essentially, like, these are a couple of questions, like, is there any specific form of health misinformation circulating in any particular language? I can give you a lot of examples because we monitor content. I can give you a lot of different examples how some content goes viral in some language but does not go viral in other language, because the people who speak that language live in particular geographical area, right? Very interesting, like, but insightful as well. So you need to see what are the languages in which different kind of content goes viral. Like vaccines, I can tell you one or two languages where it goes viral all the time, but maybe cancer, not really in those languages. So what are the couple of languages where the content goes viral, and which regions have tendency to believe in some kind of misinformation? Like if you go to Pakistan, sorry, and if you go to Pakistan and you are from a Peshawar, you are going to certainly believe a lot of things about vaccination because of history, and then a lot of, like, you can say a lot of national security issues in that country and how they were also used in some exercises and all. But if you are, for example, in some other part of the country or the world, you may believe in something else. Ebola, we saw the salt water and all. India, the Urdu language has its own dynamics. Hindi has its own dynamics. Tamil, Malayalam has its own dynamics. So we have seen actually over the last 2 years, different content moves in different spheres. And that's very important for us to understand actually. Then another thing is there a link between a disease and misinformation, or vaccination or misinformation? Like, you can see a lot of videos on diabetes, cancer, which are absolutely misleading, but they have millions of hits. Why is it that cancer attracts so many videos which are full of misinformation? Why is it that a lot of videos around vaccination have women in those videos more than men actually? So very interesting details actually there. And then what is the extent, and when these people are exposed to a false content, what happens to people, how their belief system changes over the time, over the years. We need to understand this, research this, and this is a really insightful policy areas where people need to really spend time. And is there any similarities between the content? Say a similarity between, as I was saying, when we did this Fact and Fit project, it was done our friends in Nigeria as well and India as well, and we were able to see some similarities between the two countries, and we were able to see some differences as well, how and what kind of content gets circulated. You can also see what time people upload particular content, and what does that tell you. Like if it is a disinformation, that means people are deliberately misleading people. You can find timeline actually when they usually upload some content. So I think these are very important question in terms of moving forward, in terms of building a response to, you can say, health related misinformation, vaccine related misinformation. Four quick points at the end, actually, which I think are very important for us to understand again. I don't think we have enough research available right now to understand what's happening on social media, particularly related to health and vaccines. So I think we need to invest more resources, more manpower, and more attention towards research, particularly about health, vaccines, particularly about different languages and areas. So I think this is a big area where there should be some like policies, and there should be some long-term engagements in terms of research. I think also the key here is how to scale the efforts. Like if we are doing something in India and it reaches 1 million, 2 million people, it's not really going to solve the global problem. So we really need to see, is there an alliance? Is there a network? Are there like-minded people who allow to collaborate together, build a system, build like conversations, do a monthly, bi-monthly, 6 monthly, annually, a kind of a get together, whatever way possible, and share each other's like experiences, knowledge base, and then see how can we tackle the situations. It's very important again also, like what do we need to do to make sure the credible health information goes beyond actually borders. Like if we know, okay, this source is a reliable source of information, how to make sure that we amplify that voice to a global audience, how to amplify the voice of doctors for that matter. Like when a viral video goes, a person who has nothing to do with medicine, he does a very stupid video and that gets millions of hits. A doctor with full expertise speaks on the subject, he gets 5 views or 5, 10 views. So how to amplify the voice of doctors? So there should be some conversation around that as well. Access is really again very important. How to increase the content, good content to a lot of people, for people who live in towns, but also to people who live in villages and who don't have access to internet. There are still parts of the world where there's no internet even today. So how are we reaching those communities, because they're also badly affected by misinformation? And I think also this is a challenge which will require a long-term strategy. You can't solve this over a webinar or a conference or a summit. It needs a long-term national policies and with different stakeholders on board. That this is a big challenge, is going to be a major challenge, and we have to deal with it. And this is how we're going to deal with it. And we need these people on board. So I think it has to be a long-term, and the conversation should move in that direction. At DataLEADS, we seriously think one of the key things which can make a huge difference to this conversation is to deal with the question of data deficit. Like if we make information and data available to people, that will help to build trust. So one of the things we are trying this summer, actually, we are building this data hub. Hopefully, if everything works according, as per plan, we're launching it in the month of June, July. This will be a public data hub of all the open source data which is available in the world, and we'll make sure that it is available to all our members, and is available to doctors, is available to communities, and they can join, they can use this data, they can analyze the data, they can use the way we analyze it and use that, but they can analyze it on their own. So this is a big task. We have been working on it, and we have a wonderful team which is running this initiative. So this is from like a from like a what I believe eventually, that the more the information, the data, the transparency, these are things which will bring us closer, bring the confidence of people as well, and help us to move in a direction where we can have all of us together, the doctors, the scientists, the technologists, everyone, no blame game, but all of us share this vision that we want to be in a situation where we don't fall for misinformation, where we don't get hurt because of misinformation, and where we make our platforms clean, where we make our social media platforms clean. So that requires a really global conversation. So I was really glad to join this one today, and I hope we will keep this conversation going. And from my side, that is it. And I thank you so much for patiently for listening. But if there are any questions, if there are anything, I'll be very glad to take a couple of questions.
Syed, thank you very, very much for a very rich and engaging presentation. There's a lot that I would personally like to follow up on, and there are a lot of questions that have come through from folks in the audience as well. Perhaps the first one really is related to the scaling concept. There were a number of queries as to whether that FactCheck workshop could be done in other locations. Do you have plans to roll that out in other regions and countries?
Really good question, to be honest. And I think that is the whole learning here, because we don't think we did something unique, to be honest. I don't think we did something unique. It was just people came together and they just were willing to, like, for example, our first data boot camp was hosted by a medical college, and they provided the space for that. So we are very keen, to be honest, to have collaboration in Africa. And we're very keen to have partners in Europe and learn from them as well, and see how can we do something together, a medical college. And, we're sitting together and planning something which could be really, we're looking at, to be honest, at Japan, we're looking at Korea, we're looking at Malaysia again. So we're looking for all these, expertise which are available in different parts of the world, how to bring them all together through these essentially, these are conversations. The data boot camp is essentially a 1 or 2 day event where people meet, they are like-minded in terms of their scientific temperament, and then they start the conversation, they remain in the touch. So I will be personally very keen, if you are interested to collaborate with this, in these data boot camps, I'll be very happy to take the conversation forward. And as soon as we are out of this situation, the COVID situation, we perhaps can do something on ground in different parts of the regions.
Wonderful, thank you, Syed. So a couple of other questions. One that's come through about how you actually get your data and how do you verify or validate it?
Yeah, so essentially the data is the all open source data, which essentially means the data collected by the government and then made available to parliament, or made available to state governments, or made available to global organizations as well. So what happens is that this is it's a truckload of data. But what happens traditionally, this is printed in like a books, annual reports, white papers, budget papers, and then nobody goes to, like, of course, who will has time to go through like a 20,000 budget document and scrap that data. So what our team does, essentially, they pick this open source data, they clean it from these different solos from these different places, and they bring it together on a one platform and give it you can say a heading, or give it under a tag, so that it's easy for anyone to search for it. Like you want to check, I need cancer data of 2014 of Korea, it should be just on our fingertip. You don't need to go to 20,000 documents. So, and each data set is properly attributed if it is done by a state government or a central government or any other organization in the world. And we go by reputed sources, which is essentially like a UNICEF, WHO, Lancet, other global organizations, UN for that matter, World Bank for that matter. But a lot of data which is in local languages, actually. Like if I give you an example of India again, we have 28 states. Health is a state subject in this country. The documents are written in different languages in this country. The data is in different languages. So we once wanted to check the dog bite death data in India. How many people die in India because of dog bites? And we were surprised actually to see that the data came in different languages, and it took us a lot of time to translate that. And another thing which is extremely useful in different parts of the world is the Freedom of Information Act, actually. So that gives, like in India, 4 million applications are filed every year. And that data is also a huge source of insight and analysis and research, actually.
Thank you. Yeah, a huge undertaking, really. With a lot of resources needed to do that. Another question. Thank you for sharing these tools. What about rumors and misinformation that is shared or circulated through private groups, including chat groups? Are there tools to track movement of this type of information?
Yeah, actually, if you're joining our this workshop vaccine town hall series from first, we are having two dedicated sessions actually on how to monitor content in closed WhatsApp groups or Telegram groups. So there are tools, very simple tools to monitor what's happening in closed groups on Telegram or WhatsApp. We will be doing that workshop on 1st of May. You're all welcome to join. The registration is still open. We are doing anyway 30 workshops. You can join any one of them, and we are having 1 hour discussion about how to monitor content on Telegram and WhatsApp, like essentially the closed groups.
Thank you. I think you'll probably have a surge in applicants as we're speaking. So another question has come up. Have you got any data or initiative to measure trust levels and risk perceptions? Would love to hear about them.
Yeah, very good question. We also sometimes wonder how to measure our success in terms of how people are consuming the content and how they're using the training and how they're doing after the training. So we have not done actually any research so far in terms of proper research, but we are currently we are going through a process in collaboration with the Stanford University to do first assessment study in India, which should be public in next 2-3 months, which is essentially about the training we have done in the last 1 year for the communities. Now we are going back to communities and we're trying to figure out what has their understanding, learning and understanding has been after that training, and whether that has made any difference to their thinking and their assessment. So that should be available hopefully in next, I think, a couple of months. But for every training we do, actually, we do pre-test and post-test for all the workshops, for all the conferences. And that also gives a lot of insight, actually. So we all the time spend quite a good time actually going through that assessment as well, because it allows us to see whether we are also making sure that we are meeting the hunger of participants, actually, because this is a digital world. The tools keep changing every second day, every third day. So I think that remains a challenge as well, because tools keep changing all the time. But we are also making sure whether we're getting approaches right or not, or narratives right or wrong. I think there was a slight slack, but we're okay. I think we're back.
Okay, great. You're back. Apologies for that. Could you just clarify? There've been a number of questions saying, just to confirm that the workshops that you refer to, they're online, so people can join remotely. Yeah.
I think if you follow us on DataLEADS on Twitter, you can check actually the links are all there. It's DataLEADS, DATALEADS, DataLEADS. On Twitter, the links are all there.
Super, thank you. Another question that's come from Rubel. I have been doing lots of literature reviews on misinformation, research published in various academic journals. It indicates media literacy or information literacy could help in combating fake news. Could you say anything on that?
No, I think certainly, yes. And Rubel is one of our trainers. I'm glad he's asking that question. I think, no, certainly, yes. I think we need a good expertise of media educators to lead these initiatives, because there's a huge space available for research, for good literature, so that we have informed discussion about it in our parliament, in our governments, at global forums, actually. So I think certainly, yes. And I've been happy and looking at a lot of people doing PhDs in the space of mis and disinformation. So I see a huge space. I see a space for leadership there, a new thought, and I can also see a very good possibility of collaboration among the global educators around how to deal with, particularly how to deal with the health misinformation.
Thank you very much, Syed. And I'd just like to alert people that a colleague of Syed's is putting some of the relevant links into the chat. So the link to the DataLEADS Twitter feed and the website was a little bit further up in the chat. So please do go there to find them. Syed, we're almost at time. So I wondered whether you wanted to have a few minutes to give some closing remarks before we end the webinar.
Yeah, no, I think, okay, let me put it this way. I think the challenge is going to be bigger and bigger. even after this pandemic is over. And why is that? Because the whole information landscape globally had changed, and it will change further and further, particularly in countries like in South Asia, in Southeast Asia, in Africa. A lot of new people will come on internet, where the penetration of internet is still low, actually. Like half of India is still not on internet yet. So I think that that will create a challenge, actually. How are we going to have these people on board, and how are going to we provide them a accurate, timely health information, essentially? Because I feel like misinformation politically can mislead you who to vote for, but misinformation about health can claim your life. So that's why it's quite a serious matter on health, actually. So I think world organizations like WHO really has a leadership position there. And I think there needs to be a new conversation about it. There should be open conversation about it. I can see so many new initiatives also coming. So I feel like it's also good if people can come up with ideas and be willing to share their thoughts, be willing to write about it more and more in different publications, and share their research, share their understanding. I think there's a huge learnings for each one of us from the current situation. We have learned so much. Like I think it's amazingly, like it's a tough situation, but it has also taught us so many things, actually. So I think we need to all write it, put it down, write a book, write a research paper, and make that resource available to the global audience. And I personally feel like I'm always happy for any conversation which is around, like a data, health, fact checking, collaboration. I feel honestly that scientists, doctors, and media practitioners need to work more. I think in terms of closely, they need to really put their thoughts together, how they can create a framework, but they really work in a close collaboration on these issues, because I think the information is the key. That's the bottom line. Information is the key. If you have information, you're saved. If you don't have information, if you have wrong information, then you are going to be in a very difficult situation, to be honest. So I think how to make sure that this information, people have equal access to this good information. Like if we know this is going to kill you, it's going to harm you, how are we going to tell that to a person who does not have internet, who does not have a Facebook? So that is a global, to be honest, a question of equity and equality as well to a larger extent. But I think the challenge will remain, to be honest, how are we willing, all of us are willing to learn from each other and have a conversation about it, and be very open-minded, to be honest. This is a new field. We're all learning. Every day we're learning. We're having research just yesterday now that the mask, you can remove your mask when you are at home in a limited gathering and all, because it's science. It's science. Like it changes all the time. It comes with new evidences, actually. So, and we should have, and we should spend really good quality time with our kids to bring this dialogue, on our dinner tables as well, to inform them, to educate them how important it is to have a scientific, mindset, scientific understanding. Because if we don't follow science, then we are going to be in a very difficult situation, to be honest. It's not a pandemic alone. There are a lot of other issues as well, where misinformation is really harming us as a society. So with those words, I just want to say thank you so much. Really pleasure, joining this webinar here and sharing a couple of thoughts about our work and why it's important for us to collaborate.
Thank you, Syed. The pleasure is all ours. It really has been a very interesting session, and I hope you've had time to look at the chat and to see the congratulations to you for the amazing work that you're doing. And I offer my own congratulations to that. So thank you for taking the time, and thank you for sharing with us. And I look forward to continuing the conversation with you. And thank you to all our participants who joined us today. A pleasure to have you here again, and stay safe wherever you are in the world.
Yeah, thank you so much. Stay safe, everyone. Take care of yourself. I'm looking forward to see some of you somewhere. Thanks a lot. Thank you so much.
Take care, everybody. Bye-bye.